Welcome to the Injury to Recovery YouTube channel. My name is Greg. This is Blaine from Recover Physical Therapy in Twin Falls. And last week we talked the last video we talked a little bit about how you handle postural issues with neck pain. And one of the things that we mentioned is that sometimes it can be very traumatic and come from some sort of a traumatic injury like whiplash. And Blaine, what other considerations do I need to be considering or thinking about if I've gone through whiplash as opposed to just normal day-to-day posture issues?
Great question. So whiplash most commonly happens in car wrecks. People get rear-ended. It also happens in sports sometimes. Football, people get tackled. Or sometimes like at recess, kids just get pushed in the back. And so for whiplash, physical therapy is very effective for whiplash. It's important to understand that we actually like to wait a little bit to start physical therapy after a whiplash injury. So usually about 2 to 4 weeks, depending on the severity. And most of the time when we see whiplash victims, they've usually been to the ER to make sure they don't have like a fracture in their neck or something really serious. But the research actually shows if you have had whiplash, it's actually most beneficial to kind of relax and don't worry about exercising too much for about 2 to 4 weeks. And there's actually some research that shows wearing those like soft cervical collars, not like one of those big hard plastic ones that limits you, the ones you wear after surgery.
Yeah.
I'm just talking about those little soft ones that you'll see people wearing. There is some data that shows those tend to help after whiplash just to kind of support you and kind of keep you from not moving too much.
Perhaps even telling your body, hey, you shouldn't move this far, type of thing.
Yeah. And so it might sound odd to hear a physical therapist saying not to move, because we're usually saying the opposite. And eventually you do need to start moving, but it's just important to understand that after a whiplash accident, it's okay to rest for 2 to 4 weeks, and don't be too gung-ho about exercise and physical therapy too soon. Kind of wait for that initial shock and inflammation to come back down, and then you can gently start to transition into some gentle stretches and eventually some strengthening exercises.
Let your body recover a little bit before you go, right?
Yeah, because if you start hitting the neck exercises too soon after a whiplash injury, then you can potentially make the pain worse. So,
yeah. So if you saw our video about the postural exercises, a lot of these exercises are the same, and so we'll have reused footage from that one if you don't want to worry about the two. But we just wanted to make sure that you understand that in the event of a traumatic injury, this is something where you really want to make sure that you've had a chance for your body to have some sort of recovery before starting an exercise regime.
Yeah, and we're just trying to minimize risk that way. So if you just have neck pain, non-traumatic, so you just have neck pain because you've been sitting at your desk too long or staring at your cell phone for too long, then all those exercises you can do, and it's very low risk that you'll injure yourself. But after a whiplash injury, it's okay to be real gentle and gradual and kind of respect the pain and don't push through it real hard. So if you have neck pain and say you're the type of person that's looking at a laptop for several hours a day because of your work, or if you're a dental hygienist and you're bent over working on people's teeth all day long, then that can often cause some neck pain. We often see people often have quite strong muscles in the back of their neck because they have to hold their head in that position, but the muscles in the front are kind of weak. So we'll show you some stretches that can help alleviate it, and then we'll also show some ways to strengthen the muscles in the front. So the first stretch is just a rotation stretch. And so for this one, I like to have people put one hand behind their head, the other hand on the front on their chin, and just rotate sideways and give that some gentle overpressure. And by using your hands, you can kind of push it a little bit further than what you can normally do without your hands. And so when you do this, you want to count out a nice slow 20 seconds on each side. And you don't need to torture yourself, because a lot of times if you do have neck pain, if you turn too far, it will kind of hurt. So you can push into some discomfort, but don't push so hard that you blow up your pain to where it's out of control. So about 20 seconds on each side. Do that one a couple times a day, and that helps to maintain neck range of motion.
So one of the things that I think about with this is if you do have this, you're constantly looking down, you might have a posture issue. Do you need to make sure that your neck is as straight as possible when you're doing this?
So the best posture is a kind of a dynamic, constantly moving posture. And so it's not necessarily bad to be looking down. Your neck is engineered to be able to do that.
the principle to understand is that it's just not good to be stuck in a certain posture for a long period of time. So I don't really want to say there's a bad posture or a good posture. There's just the best posture is a posture that's constantly moving. And so people can manage that by, elevating the height of your computer screen, or trying to minimizing holding your cell phone for too long in one position. It's hard if you're like a dental hygienist, because you're kind of stuck in that position for several hours a day.
Yeah, you've got the mouth right there. You have to spend your time on it.
You have to do it, yeah. But try to keep things moving.
Okay.
So the next exercise is just a side flexion, kind of an upper trap stretch. So you put one hand behind your back and then the other hand up on top of your head, and you just pull your head to the side, and you should feel a pretty good stretch up the side of your neck and your upper traps there, just above your shoulders. And I would recommend the same parameters here. Hold it for about 20 seconds on each side and do it a couple times a day. And this one usually feels pretty good.
When I'm doing stretches like these, does the 20 seconds have to be all at the same time, or can you do like 5 seconds, 10 seconds at a time?
Yeah, you can break it up. That's a good question, and there's really not a lot of research that indicates like what's the proper amount of time to stretch. There's not strong evidence that says that one time is better than another one, but breaking it up is just fine.
And don't yank it too hard, because these are some pretty, it's easy to pull pretty hard on these muscles with your arms, I would imagine, right?
It is, yeah. So kind of use your common sense. So the next exercise, this is a really good one for posture. And so I'm going to have you turn 90 degrees so that you're perpendicular to the camera. And this one's called a chin tuck. So you put your hand on your chin and you just kind of tuck your chin in, and you can use your hand to kind of push it back. And this one, you can hold it, or I'll usually recommend people just kind of go in and out into a neck protraction and retraction, and just kind of slowly push back and hold that chin tuck for a couple seconds and go in and out. And you'll usually feel a pretty good stretch kind of here, right through in here, yeah. And so a lot of people with neck pain find this to be quite challenging and quite painful when they initially start doing it. And then they do it for a couple weeks and it gets easier and it alleviates a lot of their pain. And so if you have headaches associated with your neck pain, this is a great way to combat that and help manage those headaches.
Nice.
So chin tucks are a bread and butter exercise if you have, neck pain from postural ergonomic issues.
Sounds good.
So we showed you some good neck stretches, and we're going to advance now to some more strengthening and stability exercises. And so this first one is actually an isometric. And so this is going to strengthen the deep neck flexors in the front of your neck. And so the way you'll do it is you're just going to tuck your chin in a little bit, and you just barely lift your head up a tiny bit off the bed. Just a half inch or so. And while this might look kind of easy, it's actually quite challenging. And you can probably feel those muscles in the front of your neck, right here, quivering and kind of struggling to hold your head up there.
Mm-hmm.
And so the reason this is challenging is because there's often an imbalance. So if you're holding a posture, which a lot of people do, where you're looking down a lot, then the muscles in the back of your neck are probably quite strong, and there's probably an imbalance where the muscles in the front of your neck are kind of weak. And so this is an antagonist exercise where you're going to strengthen the front of your neck muscles that support your head better, and will help to balance out that imbalance that you may have that might be causing the neck pain. So for this next exercise, and just make sure that the bed's not like pinching you up in your armpit too much.
No.
But you're going to just keep your head facing straight forward, and you're just going to lift your ear up towards your shoulder, and then let your opposite ear drop down towards your other shoulder. So it kind of stretches you when you go down, and then when you pull up, it strengthens the opposite side. And you can really go ear to shoulder on one side, then ear to shoulder on the other side. And so this one's not quite as hard as the last one we showed you, but it strengthens those lateral neck muscles pretty good. Also, this is a slightly unrelated topic, but this is a really good exercise for people trying to prevent concussions, because having a strong neck is important to prevent concussions for like football players. And if you've had a concussion, this is a concussion rehab exercise. So for the next couple exercises, these exercises actually target a little bit more your thoracic spine, which is your mid-back. And we often find that people with neck pain have issues further down in their thoracic spine. So having a good mobile thoracic spine is important for a lot of cases of neck pain. So this first one is called thread the needle. And so you're going to be on all fours like Greg is demonstrating. And you reach one arm through like so and drop your shoulder down to the bed. And you reach it all the way up and kind of turn and look at your hand as it goes up towards the air. And this puts quite a twist in your mid-back and really stretches those ribs out a little bit. And this is a great thoracic mobility exercise that can help set up a good foundation to not have neck pain. It also strengthens those muscles between your shoulder blades to kind of improve posture and pull those shoulder blades together so you don't get too tight and kind of that forward shoulder posture that a lot of people have. So you feel all right
It
there?
actually feels good.
That one does feel good. People like that one.
Yeah.
It's challenging, but it's a good exercise. So the next one is called a cat camel, or some people call it a cat dog stretch. So you're going to be on all fours and you're going to arch your mid back up like a camel has a hump. And you arch that up and then you drop it all the way down and then kind of look up as you drop it down. So some people also call it the angry cat stretch because it's like a cat arches its back when it's angry or scared.
Do some hissing or something like that.
Yeah. So if you can imagine you have x-ray vision and you're looking at Greg's spine, you want your spine to kind of be oscillating between a convex and a concave motion as it goes up, back and forth. So this one hits your thoracic and your cervical spine, your neck.
Yeah, that one feels pretty good too.
So for this last exercise, we'll do in front of the lovely bathroom door. And if you look closely, you can see the lovely toilet in the background. But this is a doorway stretch that stretches
This
out.
is a low budget film, okay?
Everyone has a doorway though, so anyone can do this. But all you need is a doorway, and you're going to put your hands up just above your head and you step forward, and that stretches out your pectoral muscles in your chest. And most people like this exercise because it feels kind of good.
Oh yeah. Yeah, this feels really good.
And the good thing about this one is you can kind of do it like every time you step in the restroom, or every time you step in or out of your office, you can just put your hands up on the door frame and step in and hold that for a few seconds and give your pectoral muscles a good deep stretch.
This one also pinches your shoulder blades together too, and that
Yeah.
feels pretty good too if you've hunched over a lot.
So for this last exercise, this is called resistive horizontal abduction. And so he's using a fairly stiff piece of elastic band there. You can start with a lighter one if you need to. But you hold your elbows straight the whole way through, and you stretch that band out. And as you're stretching the band, you squeeze your shoulder blades together. So this strengthens those muscles between your shoulder blades and kind of stretches out your pecs also as you pull back. So this is a great thoracic exercise, and it's one that we will often recommend to people who have neck pain.
So again, those are exercises that we had from the other neck injury video that we had on just normal posture, but they do apply to people that have whiplash as well. Blaine, I was thinking about this. Say I'm that individual that has gone through that whiplash experience and I have the pain, but I try to do the exercises and I don't feel like it's progressing very well. What should I consider? What should I be concerned about?
So, great question, and we do see that a lot. So, whiplash victims are often struggling with like chronic headaches. There can also be called a radicular pain or a radiating pain, like a nerve is getting pinched and you're feeling numbness or weakness or pain down your arm. And so if that's going on, you really should see a physical therapist. And so there's a lot of manual techniques we can do with our hands. And there's a lot of exercises that we can do that will help glide the nerves up. And there's a bundle of nerves that comes out your neck and down your arm. And there's a lot of maneuvers we can do to glide those nerves up and down. And those often help to release tension in the nerves. If you do have any like numbness or tingling going on in your hands. And then just manual therapy with our hands works really well for neck pain after a whiplash accident.
You know, I think about that, and I think about one of the things that I saw with treatment with your location. Here at Recover Physical Therapy, one of the things that they did that no other physical therapist had ever done to me, and that was they spent some time manipulating some of the nerves in my back when I was having issues with that, and actually I was surprised at how quickly I recovered out of that. So something to think about. If your physical therapist isn't doing that, or if they feel uncomfortable with it, maybe you need to think about finding a physical therapist that is trained and skilled and available to do that. So,
Yeah, thank you for sharing that. And it's kind of a balance because, like, in my mind, a good course of physical therapy, it has a healthy balance of some exercises, corrective exercises, and some manual therapy, because there's some stretches that you just can't quite do on yourself.
Yeah.
And so to have a trained therapist get in there with their hands, and you can mobilize and manipulate certain levels of your spine. Because like the stretches we showed you, like this is just a general stretch, or this is a general stretch. But we can get in there with our hands while you're resting or while you're stretching, and we can really force that to bend at certain segments, certain vertebral levels. And sometimes that's what you need, is a real pinpointed approach.
Yeah, move the muscle where it needs to move at the moment, and then it resets the body sometimes. So.
It does sometimes.
Okay.
It often works well.
All right. Well, hopefully you never have to deal with whiplash, but if you do, hopefully you learned something new out of this one. So thanks so much for watching. We'll catch you next time.
All right, thanks, Greg.